Everyone, today we will continue with our presentation on the radiological anatomy of the brain. This will be the second part, and we will continue later with the third part. So last time we were at the Diencephalon. Diencephalon is a term given to the following structures: the thalamus, the hypothalamus, the pineal gland, and the medulla. So these four structures collectively named Diencephalon, which is an embryological term, and I will not discuss the embryological aspects of the Diencephalon. We will stick with the anatomical aspects. So first of all, regarding the thalamus is a mass of a gray matter, or two masses of gray matter, the thalami, lie on the lateral walls of the third ventricle. So it is on the right and left side of the third ventricle, and it extends from the interventricular foramen anteriorly to the brainstem posteriorly. So the anterior limit is the interventricular foramen of Monro, and brainstem posteriorly. Its apex located anteriorly, while the posterior aspect is rounded and bulbous, and it's called the pulvinar. So the pulvinar is the posterior aspect of the thalamus, while on each side it's bounded by the posterior limb of the internal capsule and part of the genu of the internal capsule. The body and the tail of the caudate nucleus are in close contact to the thalamus on its lateral aspect. So on the lateral aspect of the thalamus, you will see the body and the tail of the caudate nucleus in contact with the thalamus and forming what's called the caudothalamic groove. Clinically, the caudothalamic groove is of very great importance in neonates. And does anybody knows what's the clinical significance of the caudothalamic groove in the neonates? Does anybody have any idea? Let's see, someone is writing the answer. Yep, exactly. The most common site of the intracranial hemorrhage in the neonate is at the caudothalamic groove. So when we do an intracranial ultrasound of a neonate, we have to be sure to see the caudothalamic groove bilaterally, and any abnormality it will be highly suggestive of an intracranial hemorrhage in the neonates especially. The superior part of the thalamus forms part of the floor of the lateral ventricle. So part of the lateral ventricle floor is formed by the thalamus. There is something called massa intermedia. We talked about it a little bit in the previous session. It is a connection between the two thalami, the right thalamus and the left thalamus. It is non-neural, so it does not contain any neurons. It has nothing to do with the brain function. Some people have it, some people don't have it. Its clinical significance is unknown to the time till now. Some say that it has a function of the function of the massa intermedia is unknown till now. It has no clinically proven function. So what is the function of the thalamus? What does the thalamus do? It is a relay of the main sensory pathways. So it has a very close relation with the sensory system, not motor, it's the sensory. While the motor information or motor fibers, which goes through the corticospinal tracts from the cortex to the spinal cord, goes through which anatomical structure? We talked about it last session, the motor part, the motor nerve fibers. The motor nerve fibers, the corticospinal tracts, goes through which anatomical structure? Anybody? We talked about it last time. The corticospinal tract passes through the internal capsule. So the motor fibers goes through the internal capsule with a specific distribution, as we said in the last talk. The especially the posterior limb of the internal capsule, is very densely packed with motor fibers, while the sensory neurons or sensory pathways are relayed in the thalami bilaterally. Now, the geniculate bodies are medial and lateral swellings on the posterior inferior aspect of the thalamus. On the posterior aspect, inferiorly of the thalamus, there are two swellings. They are the medial and lateral geniculate bodies. So the right thalamus has medial and lateral geniculate body. The left thalamus has medial and lateral geniculate bodies in form of two swellings on the posterior inferior aspect. Okay, the medial geniculate body is attached to the inferior colliculus, which has relation to do with the auditory impulses, while the lateral geniculate body is attached to the superior colliculus, which has a relation with the visual impulses. So, what do we mean by the visual impulses or auditory impulses? When you are looking somewhere and you hear a very loud sound, involuntarily you turn your head in order to see what the sound is coming from and whether the sound is representing any danger to you or not. And this involuntary movement, let's say, it is started in the colliculi, in the medial or lateral colliculus. If it's sound, it is the medial colliculus. If it is a light or some sort of light energy, it will be relayed in the superior colliculus. So the medial geniculate body is attached to the inferior colliculus related to the auditory impulses, while the lateral geniculate body attached to the superior colliculus, and it is related to the visual impulses. The blood supply of the thalamus is through the thalamostriate branches of the posterior cerebral artery, so not PCA. So let's look at this cross-sectional image of the T2 of the brain, showing the thalamus here and the thalamus here, and you can obviously see that the internal capsule, especially the posterior limb of the internal capsule, bounds it on the lateral aspect, and the third ventricle is formed by the two thalami. The posterior round aspect of the thalamus is called what? What do we call the posterior aspect of the thalamus? Let's wait for some answers. The posterior aspect of the thalamus is called pulvinar. Exactly. The posterior aspect of the rounded part of the thalamus is called the pulvinar, and you can see, although this is the head of the caudate nucleus, but if we go a little bit up, it will be the body and the tail, and this will be the part that we call the caudothalamic groove. Now, regarding the hypothalamus, hypo means under, inferior to the thalamus. It has a relation of autonomic control, thermoregulation, and appetite and sleep. So, the hypothalamus regulates your sleep, your appetite, your temperature, and your autonomic nervous system. So it's a very small part with a very big function. It forms the floor of the third ventricle, and it includes the optic chiasm, the tuber cinereum, the infundibular stalk of the pituitary gland, the mammillary bodies, and the posterior perforated substance. It's from anterior to posterior: optic chiasm, tuber cinereum, infundibular stalk, mammillary bodies, and the posterior perforated substance. All of these together is called the hypothalamus. Okay, it has an arterial supply from the anterior cerebral artery, posterior cerebral artery, and the posterior communicating artery, while it drains via the thalamostriate vein. The pineal gland, it is a very small gland, lies between the posterior ends of both thalami, just inferior to the splenium of the corpus callosum. So the splenium of the corpus callosum is above the thalami bilaterally. Inferior to it is the pineal gland, and also it lies superior to the superior colliculi below it, so it lies above the superior colliculi. It lies between the splenium and the superior colliculi. Usually it is within 3 millimeter of the midline. If you see it more than 3 millimeter from the midline, then there is some pathology and you need to look carefully. The pineal stalk, the part that holds the pineal gland, has a superior and inferior lamina, two lamina, superiorly and inferiorly. The superior lamina has the habenular commissure, while the inferior has the posterior commissure that we talked about in the last session. Between the two lamina is the posterior recess of the third ventricle. So let's look here. First, don't care about all these arrows, just this is the splenium and this is the superior colliculus, and below the splenium, above the superior colliculus, is this rounded thing here, and that is the pineal gland. And you can see the stalk, it has a superior and inferior parts, and this has the commissure, and this has also another commissure, the superior part and the inferior part, and you can see between both of them there is a recess, which is the posterior recess of the third ventricle. This is the third ventricle between the two thalami. Also you can see here, this is the left thalamus and the right thalamus, and in between them is the small tiny pineal gland, which most of the times in older age group it will be calcified, normally calcified, and there it is a site of some pathologies like pineocytoma, pineoblastoma, etc., etc. We will not talk about it because we are concerned with the anatomical aspects. Now let's talk about the pituitary gland. Pituitary gland, its other name is called hypophysis cerebri. It's the same as the pituitary gland. It has a normal diameter, differs according to the age and to the sex and to the physiological status, but in general it is about 12 millimeter transversely and 8 millimeter AP dimension and 9 millimeter in height. The pituitary gland is composed of two lobes, the anterior lobe and the posterior lobe. And between them is what's called the pars intermedia. However, the pars intermedia, it is a part of the anterior lobe, developmentally and functionally. So its function is related to the anterior lobe, its embryologic development is related to the anterior lobe, but it is a separate part that's called pars intermedia. While the infundibulum or the pituitary stalk, you can see here in this anatomical figure, this is the anterior lobe and this is the posterior lobe. In between them, this yellowish thing is the pars intermedia, and in the infundibulum or the pituitary stalk, it arises from the tuber cinereum, okay, in the floor of the third ventricle, and it is composed of nerve fibers. The body of these nerve fibers, the cells of these nerve fibers are in the hypothalamus, and it's directed antero-inferiorly. So here in the area of the hypothalamus, we have the neurons with their axes or with their nerve fibers directed antero-inferiorly through the pituitary stalk. Okay. Now, this is a sagittal section of the pituitary gland, and you can see the optic chiasm here, and the anterior and the posterior lobes of the pituitary gland. Keep in mind that the posterior lobe of the pituitary gland is always hyper intense on T1 weighted images. It's called the pituitary bright spot. We call it the pituitary bright spot. It's a hyper intense T1 signal. That is the posterior lobe of the pituitary gland, and if we don't see the hyper intense bright spot, then we have definitely a pathology, especially most likely diabetes insipidus, because this posterior lobe is responsible for the secretion or regulation of the antidiuretic hormone. So when there is no bright spot, no posterior lobe, no antidiuretic hormone, there will be a very frequent urination, a large amount, which is the pituitary diabetes insipidus. Now let's look here. This is another view. You can see the anterior lobe here, and the posterior lobe in the form of the T1 hyperintense spot. Now, what about here? This is the pituitary gland, the anterior lobe. It looks good. What about the posterior lobe? What about the bright spot? Okay. This is lost in diabetes insipidus. Here, the patient has a diabetes insipidus. Sometimes it can be ectopic, okay, and it can be seen in some cases of childhood onset hypopituitarism, and can be aberrant or ectopic position but normal functioning. So when you don't see it, you have to look elsewhere. You might see the pituitary bright spot in non-symptomatic patient. It can be just ectopic, okay. Let's see here. This is the third ventricle, as we said, and this is the splenium. Here we have the pineal gland with the posterior and inferior or superior and inferior habenula, and the superior colliculus and the inferior colliculus as part of the midbrain, okay. And we have here the third ventricle with the floor of it formed from the pons, and inferior to it is the medulla oblongata, and here we have, this is the area of the hypothalamus, starting from the optic chiasm, ending in the mammillary body. Here we can see the mammillary body, this rounded thing, and we have the pituitary stalk here forming the pituitary gland with the anterior lobe and the posterior bright spot, or the posterior lobe, that is responsible for the antidiuretic hormone secretion. However, keep in mind that the posterior lobe is composed of nerve fibers with the cells in the hypothalamus. So the cells here and sends their nerve fibers to the posterior lobe, while the anterior lobe has the nerve cell or the secretory cells in the anterior lobe. It just receives feedback mechanism from the hypothalamus, receive feedback information from the hypothalamus, and the cells are within the pituitary, the anterior pituitary lobe secretes the different hormones. So there is a difference between the anterior and posterior. The anterior has no cells, it has just nerve fibers. The cells are in the hypothalamus, while the anterior has secretory cells. This is a coronal view, also showing the stalk of the pituitary gland and the anterior lobe of the pituitary gland. And if we go a little bit posterior, we can see the posterior lobe of the pituitary gland in form of a T1 hyperintense signal. Now, let's talk a little bit about the anterior lobe. The anterior lobe, it develops from Rathke's pouch. It is 5 times larger than the posterior lobe. It contains the hypophyseal portal veins, hypophyseal venules or veins, carry the blood from the hypothalamus to the pituitary, and then the pituitary will start excreting the different hormones, the anterior lobe I mean. While the posterior lobe, it's just nerve fibers. The cell bodies are in the hypothalamus. The cells are up while the nerve fibers are down. Now, what about the anatomical relations of the pituitary gland? Superiorly, we have the diaphragma cilia, which is a diaphragm of dura mater covering the sella turcica, and above the diaphragma cilia, we have the supracillar cistern and the optic chiasm. While inferiorly, we have the sphenoid body and the sphenoid sinus. Laterally, it's limited by the dura and the cavernous sinus on the right and left sides, with all the contents of the cavernous sinus. So what's the blood supply of the pituitary gland? It is supplied by the superior hypophyseal artery, which is branched from the internal carotid artery, okay. Also supplies the hypothalamus and the infundibulum, okay. So this is the superior hypophyseal artery supplying the anterior pituitary gland and the adjacent areas. Also, portal vessels in the anterior lobe rises from capillary bed in the hypothalamus. We have in the hypothalamus a capillary bed that supplies also the anterior lobe. The inferior hypophyseal artery, which is also from the internal carotid artery, supplies the posterior lobe here. and venous drainage is through to the cavernous sinus. So it's drained by superior and inferior hypophyseal arteries. Both of them are branches from the internal carotid artery, in addition to some capillaries from the hypothalamus, and it's drained into the cavernous sinus. Before we start with the limbic lobe, is everything okay till now? Are we together? And no questions, no explanations, no comments? Okay, so everything is okay? Good. Now, let's talk about the limbic lobe. It's functionally related structures. There's multiple structures related to each other in functionally. Okay, this function is related to one another. This structure surrounds the corpus callosum on the medial surface of the cerebral hemisphere. Includes the following structures: the cingulate splenial gyrus, the parahippocampal gyrus, the hippocampus, the dentate gyrus, the fornix, and the endosium gyresium. The cingulate gyrus or cingulate splenial gyrus, it's the gyrus that curves around the corpus callosum, becomes continuous with the dentate gyrus here, okay, and then the hippocampus. So the cingulate gyrus is the part immediately above the corpus callosum, which is limited by the cingulate sulcus. And then the parahippocampal gyrus and the hippocampus, and in between the dentate gyrus and dentate nucleus, and the fornices of the lateral ventricle, and the endosium gyresium, which is a gray matter on the corpus callosum, and the lateral and medial longitudinal striae. So it's just a very thin layer of a gray matter located on the corpus callosum. Okay. Regarding the hippocampus part, it is a curved elevation in the floor of the inferior horn of the lateral ventricle. So we go to the inferior horn of the lateral ventricle, which is located in what lobe of the brain? Which lobe? Frontal, temporal, parietal, or occipital? The inferior horn of the lateral ventricle. Where is it located? In which lobe of the brain? Temporal lobe, exactly. So the inferior horn of the lateral ventricle is located in the temporal lobe of the cerebrum or cerebral hemisphere. On the floor of the temporal horn or the inferior horn, there is an elevation that is called the hippocampus. It has what's called the pes hippocampus. Pes means in Latin paw, like paw of a cat or a dog. Makhlab, okay. It's the pes hippocampus. It is an enlarged ridge and on its anterior end. The anterior end has this structure, what's called pes hippocampus. It consists of gray matter covered with white matter, and it has a function related to behavior and recent memory and emotions. So this is a section through the temporal lobe of the brain of the cerebral hemisphere, and we can see here this gray layer of gray matter with underlying layer of white matter. So first of all, we can see the dentate gyrus, this one, the number one, and what's called the cornu ammonis, this here, number two, okay, which has as we said, gray matter cortex. The third part is called the sabiculum. The sabiculum here, okay. And then the number fourth is the parahippocampal gyrus. So the most important thing to know is the this is the hippocampus, which contains the dentate, the cornu ammonis, and then the parahippocampus. Okay. This number 6 will be the inferior horn of the lateral ventricle, and of course this is the temporal lobe. So at the floor of the inferior horn of the lateral ventricle, we have this elevation representing the dentate gyrus. Okay. Now let's look at the MRI image and see what can we see here. First, we start with the inferior or temporal horn of the lateral ventricle. Okay, and then we can see the hippocampal formation, this part at the floor of the inferior horn of the lateral ventricle. So most of the times we cannot discernate each part, the dentate gyrus and the cornu ammonis, etc., etc. So together we call them the hippocampal formation. Okay, and you can see the head of the caudate nucleus at the roof of the inferior horn of the lateral ventricle. The floor is the hippocampus and the roof is the tail of the caudate nucleus, and at the end of the tail of caudate nucleus, which anatomical structure is present? At the tail of the caudate nucleus, which anatomical structure, what is the mass of gray matter that is seen at the tail of the caudate nucleus? And someone is commenting, amygdala. Exactly, the amygdala is at the end of the tail of the caudate nucleus, and this will be somewhere here, the tail of caudate nucleus, and you can see this part here, the amygdala, and you can see the inferior horn of the lateral ventricle. At the floor of it is the hippocampal formation. Okay. In the axial images, we can see the lateral ventricle inferior horn, and at the floor of it is the hippocampal and the parahippocampal structures. Now, regarding the fornix, which is also part of the limbic system, it is formed from the efferent pathways from the hippocampus to the mammillary bodies. So the pathway that goes from the hippocampus to the mammillary bodies are called the fornix, or they are located within a structure named fornix. It's composed of two crura extending posteriorly to the level below the splenium of the corpus callosum, and they unite to each other. So the crura goes posteriorly to the level of the splenium of the corpus callosum, where they unite with each other, forming a body, okay, body of the fornix, and then this body extends anteriorly at the upper surface of the thalami, on the superior surface of both thalami, and above the interventricular foramen, the body will divide into two columns which pass inferiorly between the foramen and the interventricular foramen of Monro and the anterior commissure, and forms the anterior border of the interventricular foramen. And each column passes to the hypothalamus and to the mammillary bodies. Each column passes to the hypothalamus and to the mammillary bodies. Some fibers also go to the habenular commissure. Just like here, you can see that here would be the foramen of Monro, and it is composed of two crura that passes posteriorly to the level of the splenium of corpus callosum, where they unite, forming the body of the fornix, and then they will split into the two columns that reaches to the level of the anterior aspect of the interventricular foramen, reaching to the hypothalamus and the mammillary bodies. We can see that on the axial MRI images. You can see the two crura of the fornix, okay, and they are fused together to form the body of the fornix, which again separate into two columns, and each column goes to the area of the mammillary body and the hypothalamus here. So it goes from the hippocampus inferiorly and goes under the surface of the corpus callosum. The two crura will unite, forms the body, and then they will divide into two columns, and and from the columns will form the anterior limits of the interventricular foramen of Monro. That's the foramen connecting the lateral ventricle to the third ventricle, and they will go to the mammillary body and the hypothalamus. Is it okay now? Do we get it? Okay. So let's go to the cerebellum. Let's talk a little bit about the cerebellum. The cerebellum, it lies in the occipital fossa or the posterior cranial fossa, and it is separated by the cerebrum from the cerebrum by the tentorium cerebelli, and from the pons by the fourth ventricle. So the fourth ventricle lies between the cerebellum and the pons, and the tentorium cerebelli, which is a dura mater layer, separates the cerebral hemisphere from the cerebellum. It is composed of two cerebellar hemispheres with a midline vermis, and it's connected to the brainstem by three peduncles: superior, middle, and inferior peduncles. Superior peduncle will connect it to the midbrain. The middle cerebellar peduncle, which is the largest one, connects it to the pons, and the inferior cerebellar peduncle connects the cerebellum to the medulla. So the cerebellum has a connection with the midbrain, with the pons, with the medulla via the superior, middle, and inferior peduncles respectively. Okay? Like the cerebrum, the cerebellar hemispheres has a cortex, a white matter, and deep nuclei. The largest nucleus at the cerebellum is called the dentate nucleus. Okay, the largest nucleus of the cerebellum called the dentate nucleus. The two hemispheres are divided into lobules by fissures, just like the cerebrum. The cerebrum is the same as cerebellum. They have many of similar aspects. The deepest fissure within the cerebellum is called the horizontal fissure, which extends from the convex posterior border to the depth of the hemisphere. The primary fissure divides the superior surface into small anterior and large posterior lobes. So the superior surface will be divided into anterior and posterior lobes by a primary fissure. Below the middle cerebellar peduncle, and we said the middle cerebellar peduncle connects the cerebellum to the pons. It is the largest peduncle. Below it is something called flocculus, which is a small ventral portion almost completely separated from the remainder, from the rest. This flocculus extends laterally from the midline as a slender and expanded end, making what's called the flocculonodular lobe, which is the smallest part of the cerebellum. It's a very small lobe of the cerebellum. This flocculonodular lobe is composed from the flocculus and a nodule, okay, which is also the most inferior part of the vermis. The tonsils of the cerebellum are the most anterior inferior part of the hemispheres and close to the midline. They are very close to the midline, and that's why probably of very high clinical significance in conditions of brain herniation, because they will herniate, the tonsils especially will herniate below the foramen magnum, causing obstruction to the CSF flow and onset of hydrocephalus. What about the vermis? Vermis is a part of the cerebellum, which is then it's a midline part, and it's a narrow part, not clearly separated from hemispheres superiorly, but inferiorly it is separated and lie in deep cleft. The cleft is called the vallicula. Okay, so superiorly not very well separated from the cerebellum, while inferiorly it is separated and it lies in a cleft, and this cleft is called the vallicula, and separated into named parts by fissure, which is there are fissures separating the vermis into three parts. Into two parts, which is the lingula and the nodule. So the lingula, which is the most anterior part superiorly, and the nodule, which is the most anterior part inferiorly. Anterior and inferior parts are called the lingula and the nodule, and both of them forms the vermis. And this nodule with the flocculus that we talked about before forms the smallest lobe of the cerebellum, which is the flocculonodular lobe. Regarding the arterial supply of the cerebellum, it is arising from the pica, which is the posterior inferior cerebellar artery, and the ica, the anterior inferior cerebellar artery, and the superior cerebellar arteries. Now, let's have a little contest. From where the pica arise, the posterior inferior cerebellar artery arise from what artery? From which part of the arterial system? Exactly. The posterior inferior the posterior inferior cerebellar artery is a branch of the basilar artery, while the anterior inferior cerebellar artery is a branch of the vertebral artery. Okay? Regarding, let's see if anyone has comment. Yeah. I'm sorry, I may be misspoken. The anterior inferior cerebellar artery is arise from the vertebral, while the posterior inferior cerebellar artery arising from the basilar, while the superior cerebellar arteries are definitely branches from the basilar artery. So we have two from the basilar and one from the vertebral. Okay? Ica is from the vertebral, while the pica and the superior cerebellar artery is arise from the basilar artery. Good. Now, regarding the venous drainage of the cerebellum, the precentral cerebellar vein and the superior vermian vein will drain into the great cerebral vein, while the superior and posterior parts drains into the straight and sinus and the transverse sinus, while the inferior part will drain into the inferior petrosal, sigmoid, and occipital sinuses. So, most of the cerebellum is draining into the cerebellum is draining into the cerebral venous sinuses. Okay, just the small part of the cerebellum is draining into the great cerebral vein of Galen, and then which it will drain into the rest of the cranial venous sinus system. Okay. Good. Now, let's look at the cerebellum at this coronal image, and you can see the two cerebellar hemispheres. This is the left cerebellar hemisphere and this is the right cerebellar hemisphere. Like the cerebrum, it is composed of gray matter and white matter. Gray matter and white matter, and here we have the fourth ventricle, and we can see the superior cerebellar peduncle, the middle cerebellar peduncle, and if we have another section, we will see very small inferior cerebellar peduncle. Okay, and as we said, the most inferior and medial parts of the cerebellar hemispheres are the cerebellar tonsils, which are of clinical significance since they herniate through the foramen magnum, causing obstruction to the CSF flow with onset of hydrocephalus. Another section showing the cerebellar hemispheres, and at the midline, this small part here is called the vermis of the cerebellum. Again, here we can see the tentorium cerebelli separating the cerebellum from the cerebral hemispheres. Okay, and we can see at the midline the cerebellum and cerebellar vermis at the midline here, and you can see the dentate nucleus as very thin line here, which is the largest nucleus of the cerebellum. Sagittal view shows very clearly the cerebellar hemisphere. Okay, and the fourth ventricle here, and the brainstem anterior to it, composed of midbrain, pons, and medulla. Again, we can see here the axial image shows the cerebellar tonsils. This is a very inferior view, the tonsil here and here, and you can see the vermis at the midline, which is composed of the nodule and the two anatomical structures. Now, we will talk for a little bit about the brainstem, which extends from above the tentorial hiatus, okay, to below the foramen magnum, from over the tentorium cerebelli to the inferior to the foramen magnum. It is bounded anteriorly by the clivus and the basis sphenoid bones of the skull base, and the base occiput also below, and it's composed of three parts. That's the midbrain, the pons, and the medulla oblongata. Now, let's see the external features of the midbrain. Anteriorly, there are two cerebral peduncles. Okay, the midbrain, the uppermost part of the brainstem, it has anteriorly two cerebral peduncles that's separated by the from each other by the interpeduncular fossa, which contains the interpeduncular cistern that contains CSF. The floor of the interpeduncular fossa is what's called the posterior perforated substance. So the posterior perforated substance is the floor of the interpeduncular fossa or the interpeduncular cistern, while posteriorly it has four colliculi, two superior and two inferior colliculi. So we have two superior colliculi, two inferior colliculi. As we said, they are related to auditory and visual impulses. Below the colliculi, we have this is on the posterior aspect, two colliculi, and then the small superior cerebellar peduncle. A superior cerebellar peduncle is a small one, and also the superior medullary velum is between the superior cerebellar peduncles. Between them is what's called the superior medullary velum. Now, regarding the internal features of the midbrain, the cerebral peduncles has ventrally the crus cerebri and dorsally the tegmenta, which are separated from each other by the substantia nigra. So we have two cerebral peduncles. Each peduncle is composed of the tegmentum dorsally and crus ventrally. Dorsally, ventrally, tegmentum and the crus. Between them is the substantia nigra. Also, we have two red nuclei, which is dorsal to the substantia nigra at the level of the superior colliculus. When you see the superior colliculus, you look for the substantia nigra. Dorsal to it are two red nuclei, and the tectum, which is in just the quadrigeminal plate, the plate that is dorsal to the sylvian aqueduct. Okay, we will see it on the MRI images. We can see that this is the sylvian aqueduct, and you can see the colliculi here. These are the inferior colliculi. This part that contains the inferior colliculi is the tectum of the midbrain. The tectum of the midbrain. Here we can see this black line here. This is the substantia nigra, which means the black substance, and it's called substantia nigra because it contains melanin, make their color black, and anterior to it or ventral to it is the crus of the cerebral peduncle. This is the cerebral peduncle. The substantia nigra divides into the crus and the tegmentum. Again here, the substantia nigra divides it into the crus and tegmentum. The two peduncles, this peduncle, the right and left, are separated from each other by the interpeduncular fossa or the interpeduncular cistern, and this floor here is the posterior perforated substance. Okay? Let's look again at the midbrain at the sagittal view. We can see here the tectum this part is called the tectum. This, you can see this black line, this is the cerebral aqueduct of Sylvius, this thin black line. So dorsal to it we have the tectum that contains the two colliculi, the superior colliculus and the inferior colliculus, and ventral to it is the tegmentum. And then if we go laterally left or right, we can see the cross of the cerebral peduncle. And of course here we have the interpeduncular fossa or the interpeduncular system. The midbrain give rise to few of the cranial nerves. These are the oculomotor nerves, the trochlear nerve. The oculomotor is which cranial nerve? Do you remember what cranial nerve is the oculomotor nerve? It is the third cranial nerve, while the trochlear nerve is the fourth cranial nerve. Okay, and both of them are supplying the extraocular muscles. The oculomotor nerve is emerged between the cerebral peduncles anteriorly, while the trochlear nerve emerges from the dorsal surface of the midbrain and winds around the lateral aspect. So the trochlear nerve has a long course because it's rising posteriorly and turns around the midbrain. Okay, while the oculomotor arises from the anterior aspect of the midbrain. The blood supply of the midbrain is from the superior cerebellar artery, which is a branch of the basilar artery. The venous drainage is through the posterior mesencephalic vein to the great cerebral vein. Now, radiologically, the ferritin deposition in the substantia nigra and the radionuclei causes lower signal intensity on T1 and T2. So the T1 and T2, the substantia nigra and the radionuclei, they contain ferritin, iron. So they are deposited there, causing loss of signal. They appear dark on T1 and T2. In addition, of course, the substantia nigra contains, as we said, melanin. I think we have a few more minutes to talk about the pons. So the external features of the pons, the anterior part is bulbous and rounded. It has the middle cerebellar peduncles, which are large peduncles, and has a shallow groove anteriorly in the midline that usually the basilar artery is anterior to it. The posterior surface of the upper part of the floor of the fourth ventricle, the posterior surface of the pons is the upper part of the floor of the fourth ventricle, while the medulla forms the lower part of the floor of the fourth ventricle. So the floor of the fourth ventricle is composed of upper part and lower part. The upper part is in the pons and the lower part is in the medulla. It gives rise to the trigeminal nerve, the abducens nerve, the facial, vestibulocochlear nerves. All of these are cranial nerves. The trigeminal nerve arises from the anterolateral surface, and it's easily seen on the MRI images because it's a big cranial nerve. The abducens nerve emerges at the medullary pontine junction, so at the lower aspect of the pons, at the inferior part of the pons, close to the anterior part of the midline. Also, the facial, the seventh cranial nerve, the vestibulocochlear nerves arise from the junction of the pons with the medulla laterally, the CP angle, the cerebellopontine angle there. Blood supply of the pons is from the pontine branches of the basilar artery, while the veins are anterior pontomesencephalic and inferior petrosal sinuses. So, the pons has a rounded anterior, this is the middle cerebellar peduncle that connects the cerebellar hemispheres to the pons, and we can see the posterior aspect of the pons forms the floor of the fourth ventricle, the upper part of the floor of the fourth ventricle. Okay, I think we can go back to the again. We can see the anterior surface of the pons is bulbous and rounded. Okay, and the posterior part forms the upper half of the floor of the fourth ventricle. This is the fourth ventricle. It's the upper part of the floor is formed by the pons, while the lower part is formed by the medulla oblongata, and here we have the pontomedullary junction. Multiple cranial nerves arising from the pontomedullary junction. Okay? Okay, let's finish the medulla oblongata and then, sorry, what's going on? Okay, the medulla oblongata, the last part of the brainstem, has the external features. Anteriorly, there's the ventral median fissure is deep in its superior part, a ridge on each side of the fissure called the pyramid. So we have pyramid on the right side, right paramedian, pyramid on the left paramedian aspect, two pyramids. Between them is a deep fissure called the ventral median fissure. The fibers of the pyramids will decussate, will cross from the right side to the left side, and from the left side to the right side will decussate at the inferior aspect, obliterating the median fissure. So the median fissure, you see it in the upper part, but you don't see it in the lower part. And then lateral to the pyramid, we have an oval bulge, a bulging structure called the olive, and the inferior cerebellar peduncle are lateral to the olive. So you have the ventral median fissure, then the pyramid, then the olive, then the inferior cerebellar peduncle. Adjacent projections. Posteriorly, the upper part of the posterior aspect of the medulla oblongata is the the floor of the fourth ventricle, and the lower part is closed around the central canal that will continue into the spinal cord as the central spinal canal. There are 4 tubercles on the posterior aspect of the inferior part of the medulla oblongata, 4 projections, which are the gracilis medially and the cuneate laterally. Which cranial nerves arise from the medulla oblongata? We have the 9th and the 10th cranial nerves, okay, the glossopharyngeal, the 9th cranial nerve, which is the 9th cranial nerve? The glossopharyngeal, and the vagus nerve is the 10th cranial nerve arising posterior to the olive, the medial rootlets inferior to the 10th cranial nerve, cervical rootlets from the upper spinal cord, while the 12th cranial nerve, which is the hypoglossal nerve, arise from several rootlets anterior to the olive. So we have the 9th, the 10th, the 11th, and the 12th. 4 cranial nerves arising from the medulla oblongata. So we can see here, this is the medulla oblongata at the level of the foramen magnum. You can see here part of the foramen magnum, and you can see the cerebellar tonsils here and here at the inferior part, and you can see at the anterior aspect there is the ventral median fissure with 2 bulges and on each side. These are the medullary pyramid, and then if we have a better image, we might see the olive, and then the most laterally is the inferior cerebellar peduncle. The blood supply of the medulla oblongata, the anterior part is from the vertebral artery, the basilar artery, and the posterior part of the posterior inferior cerebellar artery, or the pica, while the veins is drained to the occipital sinus posteriorly and inferiorly the pectoral sinus anteriorly. Also, communication with the spinal veins draining into the spinal venous plexus. Okay, I think we'll stop here today. We will continue after 2 days with the ventricles and the systems and the other structures. Thank you very much for listening, and thanks for your help. Hope to see you later, and stay at home, stay safe.